Oncology Systems Limited is the largest independent supplier of radiotherapy equipment to the NHS and private sector in the UK and Ireland. After surgery, radiotherapy is the most commonly used treatment for cancer and the most successful, and for all forms of treatment, it's the most cost-effective. To deliver a course of radiotherapy requires a lot of preparatory work, which requires, for example, specialised software, a range of accessories, which are usually unseen by the patient, but which culminates in a daily course of radiotherapy treatment on a treatment machine. At OSL, we provide all of this equipment, but we're particularly privileged to supply the most advanced mainstream radiotherapy machine available in the world today, Tomotherapy. Tomotherapy, which is manufactured in Madison, Wisconsin by Tomotherapy Incorporated, represents a true paradigm shift in radiotherapy, having treated its first patient in 2003 in Knoxville, Tennessee. Why is tomotherapy unique? Well, it delivers unprecedented accuracy and precision and has particular safety features. Unlike linear accelerators, machines that were invented in the 1950s and still in use today, tomotherapy is based on modern helical CT scanner technology. It delivers radiation as it continually rotates around the body in a helix with ultra-fast changes in radiation beam intensity. This intensity modulation, or IMRT as it's called, is 100 times faster than other machines and results in more precise shaping of the radiation to match the intricate shape of the tumour and results in fewer side effects for the patient. This also results in less ongoing costs for the health service.
The tomotherapy unit, when it was introduced, was part of a research study within the department, but very quickly proved its worth, and we routinely now use it for treating our head and neck patients, very aggressive tumours which would have been a challenge elsewhere on conventional linear accelerators. The patients may not have actually had radiotherapy because it would have been impossible to deliver. Tomotherapy gives us the opportunity to actually be more prescriptive to the patient and allow us to treat these more difficult cases. The unit itself has also broadened the choice that is available to the medical staff within the department about what type of treatment they wish to deliver, but it also has been driven by patient demand and patient choice. One of the things we have noticed over the last few years is actually patients are much more aware, much more educated about the techniques on offer, and routinely we are asked by the patients if we provide a tomotherapy solution for their tumour type. This has meant that we have taken referrals from all over the UK, including Scotland and Wales on a regular basis, and even from overseas, because we have been the only NHS trust for some years, or for the first 2 years of practice, which is now changing, but that has meant these patients have come to us rather than going to the private sector. After 12 months of clinical practice of the first unit, we were able to choose a second tomotherapy as a second machine, because we felt that it would continue to complement the service that we provided here at Addenbrooke's. It allowed us to continue on along our programme of IMRT and IGRT, and the tomotherapy solution offers an integrated system which you can use within your service effortlessly and seamlessly.
Tomotherapy has, I think, some really important benefits for the NHS as a whole. The first thing is that it provides for the image guidance with IMRT capability in an integrated way. That's been really important in focusing people's attention on the need for these technologies, and it's made the other manufacturers sit up and take notice as well of where they were doing too little in the marketplace. Tomotherapy seems to be very straightforward for patients. They're familiar with the general design of the machine, the circular design, which is like a CT or MRI scanner, of course. And actually the way that it's used here, the patients don't stay in the room for long enough to get bored or upset by it. And my perception is that patients find it very straightforward, in fact. Actually, we treat even some patients who are children on this machine, and if they can manage it, then that's also very good. And overall, I think that we believe that there is a reduction in side effects compared to conventional forms of radiotherapy. and patients perceive that and perceive the technology as providing something for them, as well as experiencing that in a real biological sense.
One advantage of the streamlined process of tomotherapy with having one operator station is that we can actually treat up to 65 patients at present on our 2 tomotherapy units. Our patients are in a 12-minute time slot, so we can treat between 4 and 5 patients an hour, which is very comparable to any other treatment delivery. We here at Addenbrooke's have seen a number of software and hardware developments throughout the last 2.5 years of using tomotherapy, which have helped us again to improve the process for our patients, to streamline the process, and to ensure that our patients have their treatment delivered quicker, so they're not in the room as long and they can get on about with their normal lives.
One of the key features is that we can treat patients that otherwise would have been untreatable. We had a look at our first 100 patients treated on the first Tomo unit, and we estimated that 5% of those patients, that's 5 out of 100, would have been untreatable without these technologies. So that's a very important aspect. Now, some of those patients would receive treatment for palliation of symptoms which otherwise wouldn't have been attempted or offered. And some of those patients were treated with curative intent, where the treatment simply wouldn't have been possible. This actually provides for the very best X-ray radiotherapy that's available anywhere in the world, on any platform, and that delivers outcome improvements for patients, in my view. Tomotherapy is a fantastic tool for doing image-guided IMRT. Of course, what I'm really talking about is the opportunity to provide access to those technologies. But in thinking about that, one needs to make absolutely certain that the machine will do what it says on the tin. And tomotherapy is extremely good. We can image every patient every day, and we can do the imaging every 15 minutes or so, all through the day. And the integration is fantastic. It shows that this machine was designed from the bottom up, actually quite a short time ago, and it really shows in the treatment design and the speed of the integration and operation of the unit.
With over 900 scientific publications today showing that tomotherapy is superior and flexible, we want to ensure that the public, commissioners of healthcare and other medical professions clearly understand how tomotherapy today is providing the most advanced radiotherapy and yet the most cost-effective treatment of cancer available.
We can treat patients that otherwise would have been untreatable. This actually provides the very best X-ray radiotherapy that's available anywhere in the world, on any platform, and that delivers outcome improvements for patients, in my view.